Start off with your effleurage strokes. To apply your oil. You want to open up the top of the leg first. In massage therapy, and I think a lot of therapists wind up just really going and working and starting right here. You need to think about your lymphatic system of the body. You need to open this up. These are called watersheds, sections of the body. You open up the front of the leg here, top of the leg, and then work down so that you are opening up the lymphatic system. This is called shingling. Nice good 3-4 strokes just to open up the top part of the leg. And then work your way back, always staying toward the heart. Then I like to throw in what we call that V-stroke. With a little nerve stroke back. Nice and deep. And breathing properly yourself. One more time. And start working into your calf muscle. Really working in doing compress, lift, and squeeze. Petrissage. One of the key factors that I train students to think about with petrissage, it is a compress, lift, and squeeze technique. Compress, lift, and squeeze. And as you can see, my hand is molded to the muscles. The whole part of that, or the whole reason behind that, is you're milking the muscle. You don't want your hand to come up like this and have air between your hand. That has like a pinching effect to your client, and you're not truly milking the muscles. So compress, lift, and squeeze. And the best way I tell my students is to drop a hip into this. It's a dance. You have to learn to dance around the table. So compress, lift, squeeze. Compress, lift, squeeze. So your body is going into that motion. And of course you want to smooth it out. And a lot of therapists tend to forget the Achilles tendon right here. Really friction this Achilles tendon. Do a claw method of friction. So your fingers are held in this fashion like a claw. And you friction that Achilles tendon. It feels really wonderful, especially for waitresses, people that are on their feet all day long. Really clear off this Achilles tendon. And you can just calm it down with a little nerve stroke. Doing a V-stroke, coming up into the hamstring area. We'll throw in a little bit of palmar friction here. Your ITB band runs the outside of the leg. This is a fantastic stroke to really just reach down. Palm friction. This is where you definitely have to have communication already established with your client, because this ITB band can get very tight, and they can wiggle their fingers to let you know if you are getting too deep as a therapist. As you can see, my back is staying straight. I'm in a forward lunge, and I'm lunging into my work, letting my body do the work, not my shoulders. Taking it all the way up to the top of the trochanter. You can do it in small circular motions of palmar friction. One of the other strokes that's very important is clearing off the ischial tuberosity. At the bottom part of the crease here, you have the ischial tuberosity, what is called your sit bone. It's very important that you clear off those attachments. Sink your hand using the inside hand, not your outside hand, because you would use the thumb and actually go places you don't need to. So use this inside hand, drop it right down here below the muscle line, take it all the way up, lock your palm right into there and friction back and forth. This is called clearing the ischial tuberosity. Nerve stroke back, sink in again, using this area of the hand, nice and deep, taking it all the way up and friction back and forth. Nerve stroke back, clear this out with some shingling. Then drop yourself into a position where you are doing petrissage again. And you're making sure that you're clearing all the muscle groups. You have your hamstrings here. You want to clear medial, middle, medial, and lateral. So again, middle, medial, and lateral. There again, sink those hands down into that muscle group. Compress, lift, and squeeze. Compress, lift, and squeeze. So as you can see, I'm doing the middle first. I'm going to go medial. And this hand stays kind of in a locked position so that you're not getting into what we call their private area. So you're staying in a locked position here, and you're really working this medial side. Press, lift, and squeeze. Compress, lift, and squeeze. Then, getting into the lateral side, you may come down on one knee for people that are very tall and really get into this ITB band. Compress, lift, and squeeze. You will find this is always very tight on your runners. And then just smooth it out. Stroke back. Flush out the whole leg again. And we're going to throw in what we call the topodiment strokes. One of the things about topodiment that's very important, you need to make sure when you're doing very deep, vigorous topodiment that you stay with the grain of the muscle. If you're doing what we call the light tapping, this is fine to go against the grain. If you are doing what we call a deep hacking motion, where your hands are real loose, you need to stay with the grain. And this is called hacking. Watching the popliteal nerve, this is an endangerment site, so you just kind of go over that. And you can do beating or rapping. You can hear the noise change, so this is beating. Then your hand position changes to rapping, and you can actually hear that. And again, this is hacking. And then this is quacking. You can hear it sounds like a little duck noise. Here again, anytime you do any kind of vigorous moves, you want to smooth it out and calm it down with some nerve strokes. You always want to leave them with some nerve strokes or vibration, shaking vibration, as a stroke to say goodbye. You'll have some therapists that like to do what we call jostling. They just jostle the muscles, loosening them up. And that nerve stroke to say goodbye. Now I'm just going to go ahead and demonstrate a simple